And some more kind of health risks and consequences here. If you're looking at physical abuse or deprivation, you're going to see physical health problems. Death, of course, could result. Contusions, cuts, burns, broken bones, very common. Threats of intimidation or abuse, that psychological component, essentially abuse is very common with the survivors that we work with. They're going to have severe mental health problems usually as a result of that. Could be suicidal ideation, definitely depression, anxiety, hostility, flashbacks, all of those are very common with the survivors that we work with. With sexual abuse, sexually transmitted infections, pelvic inflammatory diseases, infertility, vaginal fistulas, unwanted pregnancy, unsafe, botched abortions. That's something that's very, very common with sex trafficking survivors. One thing that folks in the medical community have to recognize is that traffickers will take their survivor into a medical setting only as a last resort. In fact, probably the number one thing that we hear from the medical providers that we work with in terms of warning signs of trafficking took place is the simplest, most basic issue that could have been dealt with squeeze of Neosporin and a Band-Aid if it was properly taken care of, becomes an incredibly painful, potentially life-threatening disease or infection because the person was not receiving any sort of care. And the trafficker didn't take them in until they knew that it was going to be life-threatening and that would be a bigger problem for them than the fact that this person was not being able to work at the capacity that the trafficker would like them to work. That's extremely common. Substance misuse, social restrictions, of course, can lead to continuing drug addiction, psychological distress. They might not be able to access care, or they can only access care very irregularly. All of this stuff. And again, check out that manual. It's got the chart, this chart basically. Additional information to review with potential human trafficking survivors. So when you're working with survivors in a medical setting, other things to really potentially focus on. When you're looking at the head, the eyes, the ears, the nose, the throat, is there a history of head trauma? Can you examine the skull for bruises, depressions, heel lacerations, exposure to loud noises, frequent headaches, pharyngeal trauma? Did I say it right? Dental, gingival pain, visual changes, sudden, gradual, all things really to look into. The neck, any history of strangulation, very, very common technique for traffickers to try to keep their victims under control is using strangulation. I understand it's a very common technique with domestic and sexual violence as well. And I actually think there's a bill in the Oregon legislature right now that deals specifically with strangulation and domestic violence. So that's incredibly common. Cardiovascular issues, trauma to the chest, respiratory issues, again, especially with labor trafficking victims, definitely respiratory issues come up, maybe because of exposure to chemicals, fumes, asbestos, major occupational hazards there, and potential exposure to TB as well. And I'll get into this, I think it's in the next slide here, but great ways to kind of look at this are, start talking to the person about their living conditions. I see that you've got this really bad cough. Can you tell me about your living situation? Because often people who have a cough that's bad are living in a situation where things aren't clean, where the conditions would warrant you developing these symptoms. Number of people sharing one bedroom, is there any ventilation, that sort of thing. Gastrointestinal issues, abdominal trauma, chronic diarrhea, constipation, visible parasites, that sort of thing. There's an extreme likelihood that these folks are not being well taken care of in terms of their nutrition. So that's going to come up. For sex, sexual trauma that includes foreign objects, definitely things to be looking at when you're looking at somebody who is potentially sex trafficking survivor. With the musculoskeletal systems, repetitive, non-repetitive work-related injuries, fractures, maybe fractures that have healed but they haven't healed properly, and you recognize that it hasn't healed properly, history of physical abuse, burns, vitamin D deficiency, all sorts of stuff there. In terms of kind of neurological and behavioral, I've worked with survivors who had severe neurological issues as a result of their trafficking situation, or that had them before the trafficking situation exacerbated the neurological issues that they were facing. Seizures, sleep disorders, looking again at histories of head trauma, and then dermatological conditions, scabies, lice, scan for fine hair, burns, fungal infections, all of that. Now, getting additional information out of your patient, again, back to that indirect questioning. You look pale. This can often mean that your diet is not really appropriate for the type of work that you're doing and what you've been doing on a regular basis here. What's your diet like? You're coughing a lot. What's your home situation like? What's your bedroom like? Do you share this space with others, and how many people? Are they sick as well? Were you injured while you were working? Very simple question that can open up a whole slew of conversations. Or something like, this is the disease that I think you might have. It's not something we see that much in America. So can you tell me about, where you're originally from, and how long have you been here, and how long have you had these conditions, or these symptoms? So now what? You suspect that maybe something isn't right here, it might be a trafficking situation. What do we do? Can you get any basic information on who brought the client in here to begin with? Is that person still here? Did they just drop the client at the doorstep and then leave? If they've dropped the client at the doorstep and they're gone, are there security tapes that you could provide to law enforcement if this comes up in the focus of an investigation? Basically any sort of basic information on how that person came to be in your care. See if you can hold the patient while a hospital social worker is called to meet with him or her. I think most hospitals have a social worker that can be called in, and that social worker can provide just basic referrals, maybe get some more basic information, can take the patient off of your hands for a little while so you can go on to the many, many other duties that you no doubt have, and speak to the client about what is going on with them. And looking at appropriate referrals. For immigrant victims, of course, you can always call us. Obviously, referrals can only be made with the patient's express permission, but you're certainly welcome to call us with any potential trafficking case. Actually, for U.S. citizens as well. With the U.S. Citizen Children, the Sexual Assault Resource Center, SARC is a wonderful organization, and SARC actually will send trained advocates to hospitals when requested. They have a 24-hour hotline. So if it's a potential trafficking situation, they'll send an advocate out. It's actually part of their standard domestic and sexual violence services program. So whenever somebody requests an advocate, SARC will send them to a hospital. Law enforcement, are you required to report? If it's a child, are you a mandatory reporter? And if so, have you explained what that means to your patient and kind of how all that is going to go down? Does the patient want to report if